question I commonly get asked by my adolescent teenage patients is, Dr. Singla, can I get a tattoo? And I never want to not let teenagers or patients feel like they can't be living a normal life, but this is one area where I get a little bit conservative. And the reason is, if you have an autoimmune condition and you're on immunosuppression, you are at increased risk for an infection. Something you have to remember is that when you get a tattoo, the needle penetrates the skin multiple times, creating little breaks in the skin, right? So that is going to automatically increase your exposure to the external world and risk of infection. Not to mention increased risk for hepatitis C, depending on where you go. If you haven't vetted out the place, you don't really know what type of instrumentation they're using, what type of sanitation they're using. So you do have to consider the increased risk. The other thing you need to think about is your risk for an allergic reaction with the dye that's being used, or wound healing after the fact. So if you've gotten a tattoo and you need to wait a few weeks to get it healing, you need to figure out whether or not the medicines you're on really impedes that wound healing process, because that's going to affect your disease course. It can cause you to flare. So these are all things you kind of have to discuss with your rheumatologist before proceeding with the tattoo.